SEAMEO RECFON, all respectable participants, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Good morning. We are delighted to welcome you to the public health webinar collaboration between SEAMEO RECFON and the Nutrition Study Program, Universitas Indonesia, with the topic Role of Nutritionist in Public Health Community. My name is Evi Armayani. I'm honored to be a Master of Ceremony for today's event. So SEAMEO RECFON and the Nutrition Study Program have a long journey of collaboration in the education field, especially for Magister and Doctorate program of the study program. And this webinar is part of RECFON's postgraduate course on public health system and community nutrition, and also part of Nutrition Magister Program majoring community nutrition. And as nutritionists play an important role in the health sector, we would like to listen to 3 knowledgeable resource persons about the role of nutritionists in public health community. But before we go to the next agenda, I would like to remind you, the participants, for the general rules of this NGTS webinar. So the first, at the end of the sessions, the participants are expected to fill out the evaluation form as the proof of your attendance today. And then the certificates will be given to the participants who completed this evaluation form. The link of the evaluation form will be shared prior to the end of the sessions. And later on, the certificates will be available 3 weeks after this webinar. And for further information, please visit SEAMEO RECFON's website and social media regularly. Be sure to subscribe and like SEAMEO RECFON YouTube channel and follow our other social media accounts. And before we enter the first session, I will read out our agenda for this morning as follows. The first agenda is the opening, and then we will have a welcome remarks from the head of the Nutrition Study Programs, the Magister Program, Dr. Diana Chandra. After that, we will have the remarks from the Director of SEAMEO RECFON, represented by the Deputy Director for Administration, Dr. Agus Haryanto. And then the first agenda, we will have presentation delivered by 3 honorable speakers, and followed by the discussions. And then the last agenda is closing. So ladies and gentlemen, as we are entering the webinar sessions, I invite you to pay respects to the SEAMEO colors, as well as gain more understanding of our organizations by watching these following videos.
achieve our goals through partnership, creating opportunities. By working hand in hand, we can accomplish all our dreams. For a better quality of life is now within our reach. Let us take a stand for our visions of hope, making future plans for the people to grow in a life filled with happiness and clean. Hear us, SEAMEO, building the future is our legacy. Let us take a stand for our visions of hope, making future plans for the people to grow in a life filled with happiness and clean. Hear us, SEAMEO, building the future is our legacy. Building the future is our legacy. At SEAMEO,
Yeah, building the future is our legacy. We hope that this webinar will also be our regular legacy for building our future. And ladies and gentlemen, we're going to listen to the welcoming remark from the head of the Magister Nutrition Study Program, Dr. Dian Novita Chandra. Dr. Dian, the time is yours.
Thank you, Ibu Evi. To the Honorable Representative of Director of SEAMEO RECFON, Bapak Agus Hayanto PhD, to our distinguished speakers, Ibu Lina Marlina, SP, Master of Nutrition from the Ministry of Health Indonesia, Bapak Sugeng Eko Irianto, MPS, PhD, MSc, Secretary General of DPP PERSAGI, and Mr. Thirukkanesh Sanvashivam from Kulim District Health Office, Malaysia, to the Honorable Course Coordinator Team of Public Health Module and the committee of this webinar, Dr. Geswange and team, and to all participants, good morning. It is an honor and privilege for me to welcome all of you to the webinar of the role of nutritionists in public health community. On behalf of the Master of Nutrition Study Program, Faculty of Medicine, Universitas Indonesia, I would like to take this opportunity to express my most profound appreciation to SEAMEO RECFON for collaborating with Master of Nutrition Study in organizing this webinar. This webinar is conducted for the audience to gain insight and information about the role of nutritionists in public health community. We know that nutritionists have an essential role in improving public health by applying nutrition and public health principles to design programs, systems, and policies aimed at improving or maintaining optimal health of the population and target groups. Therefore, this webinar will disseminate information on the latest issues related to the community nutrition care process at the community health center and nutritional care during the COVID-19 emergency response in Southeast Asia, especially of course in Indonesia. This webinar is part of the implementation of education in Master of Nutrition Study Program as a part of the Public Health and Community Nutrition Systems and Analysis module. One of the specific objectives of providing education in our study program is to provide quality higher education in the field of nutrition, with one of the goals of implementing blended learning with experts from within and outside the country. So we hope this webinar can also provide broad insights for our students. I am sure that this webinar will be profitable, beneficial, and fruitful for everyone present here. Thank you for attention. I give back to Bu Evi.
Okay, Dr. Dian, so thank you very much for your warm remarks. And now we would like to invite the representative or the director of SEAMEO RECFON, Dr. Agus Haryanto, as the Deputy Director for Administrations, to deliver his remarks. Dr. Agus, the time is yours.
Thank you very much, Ibu Evi. Very good morning, ladies and gentlemen. The representative of Universitas Indonesia, Ministry of Education and Culture, PERSAGI, honorable speakers, and all participants and committee. On behalf of our director, please allow me to say something for this opening session. The competencies and skills of nutritionists in public health focus on interpreting and communicating theoretical knowledge. Both of these are useful in supporting the provision of nutrition and health education to individuals and groups to be easily understood and used as patterns of daily life. This capability is also needed in delivering nutrition problems identification to policymakers so that nutrition interventions and appropriate policies can be implemented in a broader scope. Nutrition problems can impact the human life cycle so that the application of the good lifestyle can break the chain of nutritional issues starting from the individual to the population level. The challenge of the COVID-19 pandemic currently facing the global community with nutritional problems still occur in almost all age groups have made us realize an increasing need for qualified, responsive, and competent nutritionists in optimal numbers at every health centers publicly. Therefore, it is also necessary to increase the capacity in nutrition during the COVID-19 emergency response. As an organization engaged in the field of food and nutrition, SEAMEO RECFON Regional Center for Food and Nutrition contribute to efforts in increasing knowledge related to the food, nutrition, and health, with supporting the acceleration of improving nutritional status by utilizing the distance learning system during this pandemic, being a very effective learning method. This year, in 2020, SEAMEO RECFON held this webinar to discuss the role of nutritionists in public health community. This activity aims to disseminate information on the latest issue related to the nutritionist role in public health community. We extend our most gratefulness for the speakers, Ms. Lina Marlina from the Ministry of Health Indonesia, that will talk about nutritionists and community health Indonesia, Pak Sugeng Eko Irianto, the Secretary General of PERSAGI, that will talk about enhancing the role of nutritionists in public health, and then Thirukkanesh Sanvashivam from the Kulim District Health Office, Malaysia, that will talk about community nutritionist role in COVID-19 pandemic, best practice from Malaysia. This webinar will be moderated by Dr. Grace. So I warmly welcome the 100 more registrants from 7 Southeast Asia countries and beyond, and wish you a great learning experience in this webinar session. We hope that knowledge and skills you gain from this webinar will further be shared to your colleges and implemented in your professional work. I thank you very much, the course coordinators team and the committee of this webinar for their hard work. And also we thank our collaborator, Master of Nutrition and Study Program, Department of Nutrition, Faculty of Medicine, University of Indonesia. And finally, I thank Ministry of Education and Culture, the Government of Indonesia, for providing support for this webinar. Ladies and gentlemen, I wish you all a very successful session. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Agus, for your insightful remarks. Ladies and gentlemen, now to start the webinar, I would like to introduce our moderator, Dr. Grace Wangge. Dr. Grace Wangge is from SEAMEO RECFON. Allow me to read Dr. Grace's biography. So now Dr. Grace Wangge currently works as the Knowledge Management and Policy Support Unit Manager at the SEAMEO RECFON. And she obtained her doctorate degree at the Utrecht University, the Netherlands. Also, the master degree was obtained from the Netherlands in Netherlands Institute of Health Science, Rotterdam. And she's also the alumni of Faculty of Medicine, Universitas Indonesia, as she obtained her medical doctor from Universitas Indonesia in 2001. So Dr. Grace, I think it is enough for me to introduce you, and now the floor is yours.
Okay. Thank you so much, Mbak Evi. Thank you for the warm introduction, and it's very delighted moment for me this morning to lead this session. I believe this will be a very interesting and fruitful session for all community nutritionists, because it's very much related to our profession as a community nutritionist who's working in a primary healthcare centers. So I already have 3 speakers, as Pak Agus already explained previously. We have one speaker from Ministry of Health, Ibu Lina Marlina, who will give us a perspective from the regulators on what are the roles of nutritionists in the community. And the second speaker, Pak Sugeng Irianto from Indonesian Association of Nutritionists, will give us a perspective on how the professional organization look at these professions and how we can further develop the roles and responsibility of nutrition in the community. And lastly, we will have our last speaker, Thirukkanesh. He's a good friend of mine, and he's a very experienced community nutrition in Malaysia. And he will also give sharing his experience as a community nutritionist in Malaysia, especially during this time of pandemic. So without further ado, I will give the floor first to Ibu Lina Marlina. Yes. Also before that, there's some rules, of course. There won't be a fruitful webinar without rules. Yeah. So the rules is, I think you already entered our YouTube channel on time. Thank you very much. We recommend the use of headphones because it will help you listen to the material better. And at the end of the session, there will be an evaluation form And this evaluation form will be used by us as a proof of attendance. So if you fill in the evaluation forms, you will be also given the chance to get the certificates. With the certificate will be will be ready for you in 2 weeks after this webinars. So don't forget, we will give you the link for the evaluation form maybe half an hour to 15 minutes before this webinar ended. Yeah. And if you want to have a question, you can just post your questions by filling this link. So we already have this link, bit.ly/Q&A webinar PH. You can just type in the link in your browser, and you can just fill in your questions there. Please remember to put to whom are you going to address this question to, and we will select the questions and read it in this Q&A session that will be held after the third speaker's presentations. Okay, so thank you. I hope everything is clear, the rules. So after the rules, let's start the discussion. So I will invite Ibu Lina Marlina, M.Gizi. She is now the Head of Nutritional Surveillance Section, Directorate of Public Nutrition, Directorate General of Public Health from Ministry of Health Indonesia. She actually, for her bachelor degree, she graduated from the IPB University in Bogor in 2004. And she's also a proud alumni of our public health Magister Program in Universitas Indonesia. And she graduated in 2011. So Ibu Lina, can we hear also maybe your presentation now regarding the regulator's perspective on the community nutrition roles? The time is yours.
Okay. Thank you, Mbak Grace. Thank you for this, for your as a moderator ya. Assalamualaikum warahmatullahi wabarakatuh. Very good morning all, Excellency, distinguished participant, and also honorable guests, ladies and gentlemen. I would like also thanks to SEAMEO RECFON for arranging this webinar to discuss about the role of nutritionists in public health community. And as Mbak Grace mentioned before, in this occasion, I will sending information about the nutritionist and community health in Indonesia, how the regulation, nutrition program during pandemic, and also the challenge in implementing the program. Next. This is our president statement in the meeting, in the national meeting. He said that we have to reduce stunting to reach premium generation. This statement gives us spirit, also a challenge, because to reduce stunting is not easy things. We have to need more sectors to work together on it. The commitment of the government has sounds in the development agenda 2020 and 2024. It states that the reducing stunting has become the priority there, and beside that, also reducing maternal mortality and become the major project also, and this is where increase through competitiveness of human resources and of degree of public health. Next, this document shows and also that the National Development Agenda, RPJMN 2020 and 2024, one of the target is increase quality and competitive human resources. There are about 5 concern, and the one is accelerating public health nutrition improvement. Next, that 2 slides shows that our government really commitment to reduce stunting, especially, and other nutrition problem also. This slide shown that we are really face complicated malnutrition problem. We known as a triple burden malnutrition problem. I think some of you have already familiar with this data, yeah. We know even Indonesia has been made significant progress on reduce child stunting and also wasting, but it still become a public health problem. Prevalence of micronutrient deficiency also still high. This hidden hunger shown by half of our pregnant women suffering from anemia. And the other side, we are faced or increasing of overnutrition in under 5 children and adults. And also this increase of the triple burden malnutrition because is a matter of great concern and one of the risk of non-communicable disease. We see that in the below of the slide, we see that there are 3 main non-communicable disease that remain high in Indonesia. There are many factors that causes nutrition problem in maternal and child in Indonesia. About half of under 5 children didn't growth monitoring regularly. You can see from left and right side, they are the cause of the factor that will be cause the malnutrition problem. About half of them also didn't meet minimum dietary diversity, especially protein source, and more than 30% of baby not exclusively breastfed, and more than 40% baby have not received complete immunization. There are also many problems related to behavior and socioeconomic factor, which it indirectly causes by the indirectly causes the nutrition problem in maternal and child nutrition, such as poverty, sanitation, and also food vulnerability. Next, this slide shown that this is the other factor that may be one of the challenge for the nutrition, for the nutritionist. This show that our community consumption pattern is not good, yeah, it's not balanced. We show that less fruit and vegetable, more than around almost 100% yeah, population didn't meet recommendation consumption of fruit and vegetables, which is more than 4 or less than 400 gram per day. And also we see that there are higher of the food and beverages consumption. So it maybe will great the risk of the severe infection and also cause the decreased nutritional status, and also remain high in non-communicable disease because of the prepared food and beverages that can directly buy now with online order and other. Next. We are sorry for this slide. I didn't translate it yet. We know that the health factors to improve health status are influenced by various factors. The biggest and most influenced factor are environmental and behavior. The rest is influenced by health services and also genetic factor. Integrated and continuous intervention at every stage of the life cycle is necessary because of the nutritional and health problem were interrelated one another. Next. Because we know that the most factor that influence of the nutritional and also community health community were because of behavior problem. This the slide shown that one of the main duties of a nutritionist as a promoter, as a counselor, and also as a educator of nutrition, which is have to reach the target like for instance, adolescents, girl, pregnant moms, afterbirth moms, children under 5, and also community in the general. We have to the other duty are calculating and applying the need of for nutritional medicines, coordinating with other program and sector, intervention of case reference from posyandu, nutrition surveillance, referring unhandled case at puskesmas, monitoring evaluation, and also initiating local specific nutritional improvement innovation. Next. This is our nutrition specific intervention that become health sector main tasks that have to reach life cycle that delivered with life cycle approach in 110 day 100 first day adolescents, and also delivered with effort to optimize coverage. The intervention are breastfeeding promotion and counseling, infant and young child feeding promotion and counseling, growth and development monitoring, micronutrient supplementation, supplementary feeding, management of shift, acute malnutrition. This delivered with some strategy. One of them is increasing the health worker capacity. Now in pandemic, we modify the way we educate the work the capacity, like using this daring way. Next. During the we set from the survey with the conduct by the National Health Research Development in June, if I'm not mistaken, we see that more than 70% puskesmas still open, but only 40% puskesmas almost 50% puskesmas have eliminated posyandu services. It means posyandu is not open and growth monitoring program in posyandu is not run. And then most of the puskesmas reduce in patient visit. They are because the puskesmas only in emergency case, only open for the emergency case, and now the services were delivered by home visit. We see from the right side, there are more than 60% puskesmas has visit for the under 5 children to monitor the stunting, and also more than 5%, more than 50% of puskesmas have reduced in coverage of the immunization, and also more than half of the puskesmas conduct the patient home visit, and also more than half of the puskesmas conduct home visit for the pregnant woman. Next. To overcome the problem, we are trying to modification the services during the COVID-19 pandemic to make sure that community still has still get the good services from the health worker, especially nutritionists. One of some of the modified things are online capacity building, teleconsultation, home visit, strengthening the applicability of GERMAS, and also strengthening nutrition education to community, and also health services by implementing health promotion. Next. To in order to give the health workers can give the services, we also conduct some guidelines and protocols so that we can give services safely with some attention in transmission precaution principle during counseling and nutrition education session, nutrition services for maternal, nutrition services for under 5 children. This is the main area, and also nutrition services for adolescent school and recording and also reporting that were include in nutrition services guideline for health worker and during pandemic. Next. Beside that, we are also give some self quarantine and also some materials like how to protect family through balanced diet, how to boost immune system, how to how vegetables and fruit intake can boost immune system. And for the breastfeeding guidance will consist of breastfeeding practice protocol for lactating mothers with COVID, express preparation, delivery and storage, and also how to counselors during how to contact counselor during pandemic. This all include in breastfeeding guidance. Next. And also we are conduct education about iron folic acid supplementation for adolescents and also pregnant women, and how they can prevent anemia problem, and how they can how the best habit so that they can prevent from the anemia. Next. This is one of the example of implementation in nutrition services with health protocol in community. This is one of examples in Klaten, which is supported by the use of technology using the WhatsApp group for the counseling process. And also they implement the health protocol in community. Next. This slide only want to show you that the distribution of nutritionists until August in locus area were enough, but the distribution is not equalized yet. Yeah. Yes, there are in each province there are nutritionists, but if we see deeply to the puskesmas, there are still puskesmas were not have nutritionists. Next. In this next. Next, Pak. Hello, Pak. Next.
Maybe we should wait a bit.
Hope.
Yeah, sorry, Lina.
Oh, okay.
You can just continue.
Yeah.
To fix the...
Okay. Next slide. We are hope that competent nutritionists will be able to actually support our program. We have a Minister of Health Decree number 007 342 2020 about nutritionist professional standards. It show some criteria so that nutritionists become more professional, like able to carry out professional nutritional services, able to provide nutrition service and develop knowledge on ongoing basis, have effective communication skill, both verbal and non-verbal, have the ability to utilize information strategy for communication for community nutrition program, food administration, and clinical nutrition, also able to formulate nutritional problem based on nutrition, food biomedicine, humanities, and public health, able to carry out community nutrition service, procedures related to food, nutritional status, and health issues, and also able to manage nutritional problem and community empowerment. This one of the reference for nutrition education providers to adjust to teaching to adjust the teaching curriculum to produce qualified nutritionists. Next, the first regulation about nutritionists were declared in 2001. This called by PAN, Menteri Pendayagunaan Aparatur Negara. It's about position of functional nutritionist and credit score, but it's the only regulation about the nutritionist in 2001. But now it's already 2019, and we have to reformulate the regulation, and now based on law number 36 year 2014, the nutritionist consists of nutritionist and dietitian, and also there are many changes over 18 years. So we have to change the regulation, and now we are ongoing to reformulate the regulation about the nutritionist and dietitian function. Revision on updating decree of the Minister of PAN. It's have some goals. For instance, arrangement of the allocation and distribution, increase professionalism. Before this slide, the slide before this. Increase professionalism, strengthening the discipline system and ethic of nutritionists, adjusting the nomenclature according to law number 36 of 2014, which mandates that nutrition worker consists of nutritionist and dietitian. Next, we have program Nusantara Sehat in order to send nutritionists and the team to the reaching remote area, border, and islands. Its program has been developed about around 2016 and 2018 until now. We have already sent about 2,000 nutrition worker and also the team to the remote area, border, and islands. Next. What is the challenge and the challenge for this nutritionist thing are because the availability of nutrition worker has not reached all region in Indonesia, especially remote and border area. Diversity in quality and competence of nutrition worker in providing nutrition services, and also because of regional autonomy, a fairly dynamic turnover of nutrition worker also because a challenging. And our expectation for the educational institution and also the nutritionist world, we can support of nutrition services as priority program to prevent stunting, and also priority on strengthening community empowerment in supporting effort to accelerate sustainable nutrition improvement. We hope academic can play the role, the education, research, and community education in terms, We hope that the academic can play the role from the education, research, and community dedication in terms of education, integration, related maternal and child health and nutrition at relevant study programs, and evidence-based learning from the field, and develop knowledge and technology, new concept and theories for improving maternal and child health and nutrition. I think that's all. Thank you for your attention. Enjoy the webinar, and if you need any reference about public health nutrition, public health nutrition policy and program, there are guidelines and promotion media. You can access the link, and we'll give many kinds I mentioned in this presentation here. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you, Bu Lina, for your concise presentations. And I think you already highlighted the important and vital role of community nutritionists, especially in order in supporting the government of reaching the national development plan. Okay, thank you. And then next we will have Pak Sugeng Irianto. Pak Sugeng Irianto is the representative from PERSAGI, one of the Indonesian Association of Nutritionists. Can we have his curriculum vitae? So Pak Sugeng Irianto, MPS PhD, he graduated both of his bachelor and doctoral degrees. He got it from the UP Los Baños in the Philippines, but he originally from Malang. And then he's also now currently holding the position as the Secretary General of the PERSAGI, Indonesian Association of Nutritionists. So Pak Sugeng, can you probably give us a perspective on how the professional organizations look at the role of the community nutritionists?
Thank you, Ibu Chris. Ya, Assalamualaikum warahmatullahi wabarakatuh. Thank you much for the invitation. Today, I would like to share from professional organization side. Actually, Ibu Lina from Minister has already mentioned about the role and function of nutrition at the program. So I try to add some more about how the PERSAGI or Indonesian Nutrition Association can support the government as a professional. This is actually the outline from the committee, the profile of nutrition in Indonesia, challenge nutrition capacity at the communities, and the last is recommendation for the development of nutrition in the community setting. Yes, I would like to inform about the history of PERSAGI. Actually, PERSAGI or Indonesian Nutritionist Association established on 13th of January 1957 with the objective it's coaching and developing the professionalism. And the second is developing of knowledge, technology, and art, nutrition, health, and food, and others. The third is improving the nutrition status for individual and community. And the last is improving the welfare of the members. Right now, we have the members around 50,000 in Indonesia, and almost 40,000 members already have license certificate from the government. Based on the head law number 36 2014, the role of the professional association is the first is the set of the standard of professional competency, professional services, and endorsed by Ministry of Health. The second is together with I means Indonesian Nutrition Education for doing competency examination. This is we have so many university in Indonesia as our partner. And the third is coaching, protection, and monitoring the practices of nutritionists. And also we gave the recommendation to get a STR, means a license certificate, or a working certificate, or also practices certificate. And the last is together with KIGI. KIGI means Nutrition Collegium and also Association of Education Nutrition to develop national standard of the nutrition education and also update curriculum. This is the role of the PERSAGI day-to-day basis. Actually, for the, as Ibu Lina mentioned, and also I mentioned before, we have 50,000 member of nutritionists and dietitian. So the characteristic is of the nutritionist is the first is ability to communicate with other stakeholder at the health facilities and also at the hospital or puskesmas. The second is the quality of the services, relevant and optimum education, communicate with the patient and their family, and update the sustainable education and development. The third is orientation for the outcome oriented, loyal and monitoring. And the third is doing advocacy and socialization, the process and the results. This is to communicate the process and the result to the stakeholder. And of course, they have accountability, trusted in terms of competence, finance, and social relation. And of course, they have to priority, ability to choose the main or priority activity in the work setting. For the protocol and standard of nutrition and dietitian, we have SKKNI and development of national work competency standard as a competency base of all working field of nutritionists and dietitian. So this is already setting by the SKKNI, the development of nutritionist and dietary competence standard as a base of education. The third is development of nutritionist and dietitian career development in private sector guideline. And the last is the development of nutritionist and dietitian career development in government sector guideline, or we call in Indonesia jabatan fungsional. If we see the head law number 36 year 2014, there are many government official or head officer. One of them is we call tenaga gizi, or in the tenaga gizi we have two. First is nutritionist and the dietitian. For the current opportunity, some of the nutritionists or dietitian, they work mostly in the government, but also some of them working at university and academy as like an instructor or a lecturer, and also they work at the private sector, NGO or non-government organization, and also they work at the UN agency or international agency, and also some of them also working at the media, but many of them also working as professional independently. This is the scheme how to improve the quality of the human resources for health, including nutrition and dietitian. This is how the government provide scheme to improve the quality of the human resources for health, including nutritionists. This is like this. There is a grade from the lowest up to the highest. This is the government already provide this scheme. Actually, this is at the government. This is quite easy compared to the private sector, because sometimes at the private sector, most the competitive is very important. This is like I mentioned before, this is the career development for the non-government officer, particularly in the private company. Actually, after the graduate, fresh graduate, the nutritionist should be have like a license for the certificate competence, and also they have to working certificate also before they work as a professional. But at the private company or private sector, this is more competitive working for the nutritionist. That's why the nutritionist should be try to learn more and study hard to achieve the higher position. For the standard of competence, there are 3 areas for the competencies for the nutrition and dietitian. The first competence is clinical nutrition, and the second competence is food services, and the third competence is community nutrition. But 3 area of competence they have should the nutritionists on dietitians we have equal. 3 of them should be have, cannot be only 1, 2, but 3. They have to have 3 competence as a professional nutritionist and also dietitian. This is the data. Actually, Ibu Lina also already mentioned how the distribution of the nutrition at the puskesmas level in Indonesia. This is the distribution, and also education level, and also the contract of the nutritionist. Yes. Based on the Rifaskas 2011 and also Risnakas 2017, the nutrition in Indonesia, they still have lower than Diplomatika, or we call Diploma 1, yeah. Some of them still have Diploma 1. But for the, mostly, we have graduated from Diploma 3, or in the past we call M.Gizi, but some of them already attended the higher education in S1 or Sarjana or Diploma 4, but some of them also already in Magister level. But mostly the nutritionists in Indonesia or puskesmas or even in hospital still Diploma 3 or M.Gizi. For the contract status, of course, most of them are the government official, both in puskesmas and also at the hospital. But some of them also still in the volunteer or honorarium or sukarela or by contract by institution. This is the data in Indonesia without nutritionists. I think some of province also still have many, without nutritionists. That's why we still have problem how to deploy nutritionists at the health facilities. This is based on Risnakas 2017. There is a distribution of district based on health center without nutritionists. 0%, I mean this is 132, and this 100. This is a district without a nutritionist, mostly in the Papua. That's why we try to engage, to advocate the local government how to deploy nutrition. This is quite problem because actually we have to deploy local nutritionists. That's why we cannot push the nutrition from other provinces go to there. But actually right now also the government have program Nusantara Sehat. This is one of the strategy how to deploy nutritionists at the remote area or eastern part of Indonesia. This is actually I already mentioned before. This is the how we can divide it. This is technical dietitian. This is graded from diplomatry or academic gizi. For the nutritionist as a diploma 4 or S1, but for dietitian they have completed S1 or D4 with professional education for dietitian. This is the competency of the, they have to have it. Like for example, technical dietitian, they have to have competence of the clinical 30%, like this 20 and like this. This is the component of the technical dietitian, nutritionist, and also dietitian. Now, scope of conceptual framework of community nutrition. Actually, as a nutritionist, there is a responsibility, integrity, good governance, both management of general nutrition and also management of technical nutrition services. We have 5 functions. The first function is detect all about community nutrition problem based on data and information. This is very basic. We have to know community nutrition problem based on the data. That's why one of the function is this is in surveillance, very important. The second is the function is response. This is management aspect, give a technical advice, areas and human resources availability. That's why without availability of the human resource quite difficult. That's why we have to deploy. The third function is for the functional group, remote areas that I mentioned in the part of the eastern part of Indonesia, and also implementing of service standard and operational procedure. Of course, the fourth function is to prevent targeted group as a beneficiaries continuum of care. The last is the promote of ill states continuum of care, leave no behind. For the nutritionist or dietitian, they have scope of expert. Of course, is first is we have to know about nutrition. This is human nutrition. Below is public health nutrition, and also food science, and also therapeutic nutrition. This is what science that should have by nutritionists, expert, animal nutrition, agronomy, food supply, and others. This is very complexity of the scope of nutrition expert. That's why they have to learn more and more. For the profile of dietitian, I will mention about 2, dietitian and nutritionist. The first is what is the profile of dietitian? dietitian, she or he, have as a provider of nutrition and dietetic services independently and professional based on principle of biomedical, nutrition, dietetic, and food and humanitarian. How about the profile of nutritionist? As a nutritionist, he or she provider of nutrition services professionally as well as a promotive, preventive services based on the principle of food science, nutrition, and public health. Oh, I think this all already mentioned. Now, I will mention about the role of dietitian and nutritionist. For the dietitian, the first role is the she or he provide a nutritional process and dietetic independently, collaborative, delegative based on principle of patient care, patient-centered care. The second, planning and counseling, nutrition education, and dietetic on curative and rehabilitative. The third is design, implement, monitor, and nutrition therapy and dietetic for medical nutrition therapy as a curative and rehabilitative service. While for the nutritionist, he or she provide community nutrition services based on scientific and holistically. Same I think dietitian, planning, implement, develop and evaluate counseling, training, and education for individual, groups, and community. Planning, handling, develop, and evaluate nutrition and dietetic for individual, group, and communities as a promotive and preventive intervention. Food services based on food safety, health, and patient safety principle. For the dietitian, food services catering care at the health facility or hospital or puskesmas with bed, and then develop food product for patient diet. They say they need innovation. Food and dietetic research and development. This is very important also for career development and also to improve the quality of the professional. The last is networking building for career and institutional development. For the nutritionist, the role is food and nutrition health research and development. I think same with the dietitian. Networking building, policy brief writing and advocacy, monitoring and evaluation, and create and develop nutripreneurship. This is very important now, particularly during pandemic, how to create and develop nutripreneurship. This is the area of competency. I think I will combine both of nutrition and dietitian. The first is, of course, ethic professionalism, both of them, self-aware and development. Effective communication is very important, and also scientific base. They have to improve the quality knowledge every time. Community nutrition, food services, and clinical nutrition, community nutrition service, and community empowerment. This is also what areas of the dietitian and nutritionist. This is, sorry, still in bahasa. This is also the career development for the non-ASN, non-government official. If in the KKNI, there is a level from the lowest is the diploma 3, this is level 5, diploma 4 or S1 is level 6, with a profession education level 7, specialist or magister, this is level 8, then level 9 as a doctor or subspecialist. This is the level of the nutritionist. Some of them already at the level 9, some of them also in the level 8, but mostly still level 6 and 7. That's why we have, as a professional association, we have to encourage them to improve the knowledge of them. Now, how the PERSAGI policy facing COVID-19 pandemics? I think Ibu Lina also already mentioned. The first is, of course, member unconditional solidarity, give public services at both puskesmas and also hospital, and also stakeholder relation and partnership, protecting members, and also increasing competency of the members. This is during the pandemic COVID-19. We conducted Good Morning PERSAGI or Sapa PERSAGI. We organize every Saturday. I think already 12 or 15 times till now. We also online activity in every end of the month to share information, current issue, and update the knowledge. And also the number so many, sometimes more than 1,000 to attend a webinar, because right now this is a very good opportunity to improve the knowledge through virtual platform. This is the activity. And also during the pandemic, we supported the government to recruit and distributed as a volunteer at the Wisma Atlet and also at the local government hospital and other hospital in Indonesia. This is a collaborate with Minister of Health or PPSDM. Now I think already 5 beds at the Wisma Atlet, and also we work with the government, with Directorate of Community Nutrition in Ibu Lina office, how to develop the guideline during COVID-19. These are the challenges of nutrition capacity at the communities. The first is the global environment and technology development related to health and nutrition. This is very fast. That's why the nutrition should be ready to update of the knowledge. The second is still have high prevalence of malnutrition, like Ibu Lina mentioned about the wasting, anemia, stunting, and others. That's why the nutrition should be create innovation to tackle malnutrition and networking with other professional organizations or IPC. IPC means interprofessional collaboration. That's why we cannot do as a business as usual. We have to innovate, create innovation, how to handle malnutrition, working with other professional associations. The third challenge is the improve of number of nutrition institutions to produce nutritionists. Right now, almost every provinces have Diploma 3 and Diploma 4, and also more than 100, I think, they have S1 or full degree to produce nutritionists. That's why our role is how to standardize curriculum and also standardize of competency and create working opportunity. Because if not, this will become a trouble, become a problem also. During pandemic COVID-19, we have to update or upgrade knowledge of nutrition emergency and pandemic knowledge. This is why we call beyond health and nutrition. I think the last slide is we will give recommendation for the development of nutrition at the community setting. The first is the collaborate with KIGI means Collegium of Nutrition, and institutional education of nutrition to regular review and update curriculum based on the program needs. That's why also we support the nutrition what the need of the program. Without collaboration with the government, we don't know what is the need of the program. The second, PERSAGI collaborate with the government as a part of National Task Force of Scale Up Nutrition Movement. This is led by Bappenas, and also other nutrition program, including Directorate of Community Nutrition Ministry of Health. Build networking with other professional organizations, universities, NGO, and UN agency. This is already started a long time ago. We work with them to encourage or to improve our knowledge and also collaboration. The last is the capacity building of the members regularly, particularly update knowledge with IT base. This is very important through training, seminar, workshop, professional education, and other. I think this is our sharing for how we can collaborate with other unit, other ministry, and other institution in order to improve the quality of the nutritionist at the community setting. Because right now we know we feel with the big number of nutritionists without our support, this is very difficult of the member to improve by themselves. I think again, thank you very much. Selamat pagi. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you so much, Pak Sugeng. I think I will take your last point about the collaboration and say that we are from SEAMEO RECFON and also PERSAGI Faculty of Medicine Universitas Indonesia will be ready to collaborate to how we can increase the capability of our nutritionists. But also, I think the first part of your presentation is also very interesting about the distribution of nutritionists. Something that we can think about and maybe later discuss also with Ibu Lina from the Ministry of Health. So I will go to our third speaker, our last speaker for today. We have now, but before that, I would like to remind you that, that you can post your question by filling the link or bit.ly/Q&A webinar PH. And there was a technical difficulty in the beginning, so some of the question for Ibu Lina and Pak Sugeng was missing. So if you don't mind, the one who already posed question, you can try to fill in the link, the form again, because there was a technical issue that we cannot see your question. So I believe it's a very interesting and provocating questions. So it will be something pity for us. We cannot post a question to our resource persons. So I would like to invite now Thirukkanesh Sanvashivam, our speaker from Malaysia. Thirukkanesh Sanvashivam, or we usually call him Thiru. He is now a nutritionist from Kulim District Health Office in Malaysia. He was graduated, he finished his bachelor and master degree from University Kebangsaan Malaysia in Kuala Lumpur. But in the recent years, I think Thiru has been working with near Penang. Before in Kulim, he's working in Kedah, Malaysia, and I also see in YouTube some of people watching actually also from Kedah, Malaysia. So thank you for joining us this morning, Thiru. And I think it will be interesting now to hear about your experience as a nutritionist in the community, both in Kulim and also probably your previous experience in other part of Malaysia. Because I already I just saw on map that actually both Kedah and Kulim is actually most on the northern part of Malaysia. Yeah, in Semenanjung Malaya, it's almost in the border with the Thailand. Okay, Thiru, can you maybe start with sharing your slide? I think we miss Thiru, yeah? Thiru, are you still there?
I think we lost him, so maybe we will wait for.
Oh, okay, it's him now.
Sorry, I couldn't share my
I
screen.
see that you changed your background.
Yeah. Okay, let me share my screen for a while.
Yes. Okay, nice. We can see your slide now.
Yeah?
Yes. Just put it in the slideshow, probably.
Okay, very good morning, everyone. Thank you very much, Dr. Grace, for the kind introduction about me. And it is my pleasure to be virtually with SEAMEO RECFON again after our program with CNLP. And today I will be sharing about the role of community nutritionists in Malaysia and the changes the pandemic has brought to the profession, if any. Malaysia, as we know, is one of the member countries of ASEAN.
Thiru, sorry to cut you, but I think your slide is not moving. Can you put it in the slideshow first?
Is it visible now?
It's still in the PowerPoint mode, so it's not in the slideshows mode. Or otherwise, you can just have the PowerPoint.
Can I request Tohir to share?
Yeah, maybe we can help you with the sharing slide. Is that possible, Tohir? Yeah. Okay. Okay, you just wait. So it's very interesting background you have there. Because I think we're Indonesian, we can actually understand some of the words, but hopefully there won't be any misunderstanding. Okay, we're still waiting for the slides to load. So Thiru, is that correct? Then you are working basically in the major areas of the border area of Malaysia, yeah, in the northern part.
Yes, I live in Penang and I'm working in Kulim, Kedah. So I'm crossing the border of the two states, commuting to work daily.
Okay. Okay, I think we can already see the slide now on screen. Yeah. Okay, so Thiru, go ahead.
All right, thank you, Grace. Okay, moving to the next slide. Okay, Malaysia, as we know, is one of the member country of ASEAN with a population of 32.6 million people. There are altogether about 14 states, and the country is divided into two, namely Peninsular Malaysia and East Malaysia. And it is actually separated by the South China Sea. The capital city is Kuala Lumpur, with Bahasa Malaysia as the official language of the nation. Next slide. In Malaysia, the nutrition profession or a nutritionist is defined as an individual who is trained and registered as a nutritionist to advocate and promote nutritional well-being of the individual and population as a whole in preventing and controlling nutrition-related diseases of target groups or at various levels through policies, education, training, assessments, interventions, and R&D. Therefore, only those with a minimum qualification of a bachelor degree from listed universities fulfilling the requirements of sufficient nutrition courses can be registered and practice as a nutritionist. Next. With regards to that, currently we have about 450 nutritionists, or 451 to be precise, with the Health Ministry deployed at the headquarters of Nutrition Division of the Ministry of Health in the Federal Territory of Putrajaya, mainly overseeing the overall management and administration, professionalism, policy making, and development. Besides, there are nutritionists at the state health departments of the states in Malaysia for the management, administration, and surveillance, while majority of the nutritionists are at a very ground level of district health officers and government health clinics, which are the policy implementers and interacting actively with the community. Besides, there are also nutritionists at institutions such as National Lactation Center, Institute of Medical Research, IMR, and National Institute of Health, whom carries out research and development and specific activity and programs accordingly. However, these placements of the deployment of the nutritionists does not include private practice nutritionists. Next. As I mentioned about the nutrition division, this is basically the brief background of nutrition programs in Malaysia dated back to 1950s, whereby at that time, nutrition programs were integrated into the maternal and child healthcare services. Years later, in 1970s, the Food Nutrition Science Officer, or what we call it as Pegawai Zat Makanan, PZM, post was established at the national level. And it was later on expanded to state health departments a few years later. In the year 1995, the nutrition branch was established under the Family Health Development Division. And about 15 years later, in the year 2019, it was upgraded as a division by itself called Nutrition Division and led by the Director of Nutrition. And in the year 2011, the current name of Food Nutrition Science Officer post was then changed to Nutrition Science Officer, or fondly called as Pegawai Sains Pemakanan in the year 2011. Next. The Nutrition Division of the Ministry of Health was established with a vision to become the key driver of national nutrition towards the development of healthy generations. As such, its missions are to develop and implement effective nutritional programs to individuals, groups, and society. And to ensure effective implementation, nutrition component has to be integrated into national development policies and programs. And which is for that, the interagency cooperation has to be improved in order for successful implementation of activities. However, all this will not materialize without the active societal participation, which is listed as part of the mission of Nutrition Division. Next. The Nutrition Division's objectives are firstly, to assess and monitor the nutritional status of the society. Secondly, to accordingly promote healthy nutritional practices in every area of the society. And thirdly, to prevent and control nutrition problems associated with issues such as under and overnutrition, as typically Malaysia is facing the double malnutrition problems such as stunting and anemia, which is still prevalent among the population, and as well as obesity and diabetes, with Malaysia reporting among the highest prevalences in the region. Next. So in order to ensure a smooth and well-coordinated implementation of the nutritional programs, the Nutrition Division is divided into three main sections, which are the Nutrition Policy and Planning, Family Nutrition, and Community and Interagency Nutrition. Therefore, I will discuss the role of nutritionists in the public health settings according to these sections for a better understanding, as we have extensive activities and programs to reach out all segments at the population level. So firstly, the Nutrition Policy and Planning section has a few subsectors, among which are the National Food and Nutrition Regulation, whereby it oversees the National Plan of Action on Nutrition in Malaysia, or what we call is as NPAM. The NPAM is actually a 10 years period of plan of action, currently in its third edition from 2016 to 2025, which represents the Malaysia's continued commitment to the Rome Declaration on Nutrition to achieve optimal nutrition well-being of nations. It addresses both nutritional deficiencies and diet-related non-communicable diseases. As prevention and control of nutrition challenges requires the collaboration of multiple stakeholders, the NPAM calls for all stakeholders to incorporate nutrition strategies into their respective programs. And the National Coordinating Committee for Food and Nutrition, NCCFN, develops the Malaysian Dietary Guidelines, the Malaysian Food Pyramid, and it serves as the basis for nutritional approach in meeting nutritional requirements of the population to ensure the nutritional health and wellness of the society. This section also regulates the professional development, standard and quality, and as well as the being the strategic human resources management in terms of recruitment, placements of nutritionists, and career development for nutritionists. Besides, it ensures ethics and professionalism of nutritionists are always maintained. And with regards to that, the professional development subsector managed to secure 3 subject matter experts, or what we call it as SMEs, areas for the nutrition profession in Malaysia. So the areas are nutritional epidemiology, public health nutrition, and maternal, infant, and young child nutrition. And this is actually for the better career prospects and development for the practicing nutritionists in the public sector. Besides, they serve as the backbone for the nutritionist profession under the Allied Health Professionals Act, AHP, in ensuring all nutritionists are registered and the job scope are regulated accordingly to ensure no crossovers with other healthcare professionals, and nutrition is practiced with integrity. Besides, these are the highlights of the nutritionist scope of practice in Malaysia, which as per the Act 774, Allied Health Professionals Act. Next slide. The scope of practice of nutritionists will be to advocate and promote nutritional well-being, to prevent and control nutrition-related diseases, to assess, monitor, and evaluate nutritional status, to provide input for the development and implementation of nutrition policies and action plans, to undertake and support nutrition research and communicate the findings, to develop, implement, and evaluate nutrition interventions, to undertake capacity building in nutrition through education and training. Next. Coordinate and carry out multi-sectoral nutrition activities, provide guidance on nutritional aspects for the formulation and development of products and services, provide technical advice for the development and implementation on food regulations and guidelines, provide technical advice for the nutrition and nutrition-related matters, providing input on product quality and safety from the nutrition perspective, and as well provide nutrition communication materials complying with the prevailing regulations and guidelines. Next. And nutritionists in this section also oversees and ensures that all nutrition strategies and programs are in line with the National Nutrition Policy, which was developed and approved by the Malaysian government. The policy aims to ensure that the well-being of the people is achieved and maintained through nutrition to enable them to contribute effectively towards the development of the country. This policy is in the process of being reviewed to be in line with the National Plan of Action of Nutrition Malaysia and PAM3, as well as the current needs, directions, and latest policies that have been formulated from within and outside the country. For nutrition surveillance, nutrition scope is in the information systems management in the matter of reports and data collections. For instance, the Malaysia Food Composition Database, which has most of local foods, nutrient compositions for easy referral by all walks of life, and continuously updating the database to be more inclusive. The nutritionist also works closely with higher learning institutions and the Nutrition Society of Malaysia and nutrition experts in the field in identifying and proposing nutritional researches for evidence-based nutrition practice. Next. Secondly, the scope of practice under the family nutrition section goes across the life stages. We can see for the maternal nutrition, there's also infants and toddlers nutrition, mainly under 5 children, childhood and adolescence, and adulthood and geriatric nutrition. So for the maternal nutrition, the community nutritionist basically focuses on the advocacy and rehabilitation through promotion and intervention both at the clinics and community settings for the best outcomes of the stages of prenatal, antenatal, and postnatal nutrition. It includes providing counseling, nutrition counseling for pre-pregnancy care to ensure women of reproductive age are in the peak of their health when planning for their pregnancy, and to ensure safe pregnancy during antenatal and delivery for a well-nourished mother and infant. And for the postnatal, we ensure that women are well with the ability of healthy upbringing of their children after the delivery. This includes the monitoring and intervention in terms of gestational weight gain, which is incorporated into the maternal healthcare services and primary healthcare services that handles the pre-pregnancy care. And we also have the full cream milk supplementary nutrition program in place, offering full cream milk to provide a nutritional support to improve the nutritional status of low socioeconomic pregnant women. For the universal salt iodization, beginning the 1st of January in the year 2021, the whole of Malaysia will be gazetted under the universal salt iodization program, and therefore nutrition education in terms of micronutrients and the use of iodized salt will be another scope of nutritionists even before the full gazettement due next year. And as part of the WHO's global initiative in promoting breastfeeding, breastfeeding and complementary feeding promotion are carried out extensively nationwide by all our nutritionists. Nutritionists work closely with healthcare professionals, non-governmental organizations, and community to promote and most importantly protect breastfeeding, and thereafter the timely and appropriate introduction of complementary feeding, which is proven to prevent various nutrition-related diseases among children. And as part of the breastfeeding promotion, there is the baby-friendly hospital initiative in ensuring breastfeeding are always being safeguarded at all levels of patient or clients' care and management. Therefore, it needs continuous promotion, monitoring, advocacy, and personnel training to be conducted by the nutritionists. And for your understanding, in Malaysian setting, antenatal care and postnatal care are basically at the public health clinics, including the child health services. However, women actually give birth at the hospital settings. Therefore, there is a need in expansion of the initiative to health clinics so that the baby-friendly initiative are seamless. And presently, all government hospitals are accredited as baby-friendly hospitals, and next, the same target are adopted for the baby-friendly clinics. In ensuring the food and nutrition security for children for the optimal growth, community nutritionists are involved in a rehabilitation program for children, such as providing counseling and intervention for malnourished children who are, for example, underweight, wasted, stunted, and as well as preventing all these nutritional issues among children via preventive measures, such as conducting cooking demonstrations and frequent advocacy via community engagements, such as the awareness on the first 1,000 days programs, monitoring of meals at child nurseries and preschools, and parenting workshops for parents and caregivers, as well as personnel at institutions, for example, nurseries. For the underprivileged children, there are 2 types of programs, namely the food basket program and community feeding program, in ensuring food and nutrition security for their growth, which includes providing food provisions, home visits, in nutritional counselings, and cooking demonstration. Next. For childhood and adolescents nutrition, the nutritionist has several programs, including preschool nutrition activities, monitoring of school canteens, school dormitories, and as well as school nutrition program and supplementary feeding programs. This aims to inculcate healthy eating habits since young for healthy eating practices to become sustainable throughout the life stages. Since this has been extensively discussed by our senior nutritionist, Ms. Aina Nasrina, at the Nutrition Goes to School NGTS webinar last month. So therefore, I think that the participants can actually access the SEAMEO RECFON YouTube channel for further information about the nutrition on the childhood and adolescent nutrition. And for adulthood and geriatric nutrition, as many of us knows, we Malaysians loves eating out and are very creative with recipes. And therefore, nutritionists work tirelessly in promoting healthy eating habits and promote recipe modifications and creating awareness among adults so as they will change their dietary habits at least to an extent, if not entirely, for the prevention of non-communicable diseases such as obesity, abdominal obesity, diabetes, hypertension incidents that are very much prevalent among this particular age group. Among the programs, Healthy Cafeteria, which is strategized as compulsory for all cafeterias operating in the Health Ministry facilities, and it was later expanded to other facilities and cafeterias at workplaces and also school canteens. Besides the serving of healthy meals during meetings, provides that another initiative to promote intake of vegetables and fruits, and plain water is available at all times. Besides separating sugar and milk from hot beverages during meetings and official functions. Therefore, this includes the training and of the food handlers and caterers to ensure they abide by these criteria during serving food for the participants of the functions. And in collaboration with the Food Safety and Quality Department, there's also the Clean, Safe and Healthy Initiative, or in Bahasa we call it as Bersih, Selamat and Sehat, BEST, which serves as a stepping stone for the cafeterias operators to obtain the even stricter healthy cafeteria certification. Nutritionists in Malaysia are not just involved in the certifying process, but also in promotion, advocating, guiding, training the food handlers with healthy catering modules developed by the nutrition division so that food prepared and sold are healthier as well. And as more restaurants, cafeterias are mushrooming nationwide, this job scope is almost never ending as of now. Next slide. For the community and interagencies nutrition section, obesity and non-communicable diseases prevention scope involves the community healthy kitchen, such as conducting training or cooking demonstrations for the local community, new healthier recipe development and testings of the recipes, and agriculture activities with the involvement of the member of the local community to encourage intake of vegetables and as well as local fruits. This is mainly to empower them in practicing healthy eating, and these informations will be further disseminated by the community to fellow villagers and neighborhood members. The healthy shopping program are also being conducted to ensure participants get involved with real-time approach themselves in discovering the knowledge of food labeling and nutrition facts and ingredients of products at supermarkets itself, and choosing food products wisely. So this is basically, as you can notice at the picture, is conducted at the respective supermarkets or hypermarkets in selected locations. So the participants usually feel more empowered when they entirely get involved rather than merely exposed to the knowledge via talks in four walls in the halls and in a meeting room and etc. The nutritionists realized and acknowledged that the food beverage industry play an important role in shaping the eating habits of the community. Therefore, the industrial collaboration is vital, especially in food labeling and product formulation. The Healthier Choice logo HCL and front of pack labeling serves as a mean to enable much easier informed choice decision making when the individual choosing and purchasing a product within the same category. The public are being educated regarding these logos and to make full use of it for a healthier purchase. So the criteria for the healthier choice logo are also consistently reviewed so that at one point of time in the future, there are only healthy products available in the market. And the Code of Ethics and Marketing of Infant Food and Related Products are also in place in Malaysia as part of the global initiative. And nutritionists ensures industries abide by the code through continuous monitoring at various facilities such as the private health facilities, clinics, public health facilities, maternity centers, stores, supermarkets, and even child nurseries. Next. And for the institutional nutrition sector, nutritionists conduct monitoring of food served and carries out programs such as the special needs children rehabilitation centers by promote healthy eating. You can see one of the picture of the activity in this slide. For example, there's a 2-in-1 program which focuses on the promoting consumption of nuts and legumes via arts and crafts activity using dry nuts and legumes. So this activity is developed using occupational therapy techniques of the eye and hand coordination method. This proves that our nutritionists must be constantly creative and innovative in providing their services and work closely with other healthcare professionals and engage in a multidisciplinary approach for the best health outcomes. And we also provide nutrition services and advocacy, as I've discussed earlier, for individuals such as counseling, training, and for food handlers and for community. We conduct exhibitions, roadshows at various locations, such as workplace and events such as National Sports Day, Children's Day, Parents Teachers Association meeting, and festivals, and many other. And part of it, the Nutrition Information Center, which serves as the center of nutrition knowledge for the public, enables them to gain insights of nutrition. And actually, it is available at various locations nationwide with a minimum of 1 center in every state. Nevertheless, these are basically the role of nutritionists at the public health settings, whereas there are many other programs and activities being the scope of nutritionists, which are not being discussed extensively due to the time constraints. So fundamentally, the community nutritionist job scope in Malaysia is very diverse and covers a wide age group and areas so that no one is left behind in obtaining nutritional knowledge and makes it a part of their lifestyle for their nutritional well-being. Next. However, due to the COVID-19 pandemic, which has affected Malaysia and globally, the services and scope of practice of community nutritionists in Malaysia are being challenged and threatened. And I would say it is indeed timely to discuss these, as COVID-19 pandemic has just celebrated its first birthday, as the virus was first discovered on the 17th of November in the year 2019 in China. So personally, by any means, I'm not feel like extending a birthday wish to COVID-19 virus. Therefore, moving back to our discussion, the scope of practice definitely has not changed actually, but the way the programs are managed and delivered has somewhat fine-tuned. And again, the community nutritionist has to be consistently proactive, creative, and innovative in ensuring the service are not being hampered. Next. Chronologically, this is the impact of COVID-19 to Malaysia. We encountered a series of movement control order beginning 18th of March this year. We had strict movement control whereby Malaysians are not allowed to be out except for obtaining essential needs and services. Eventually, it was relaxed with a conditional movement control order. However, due to the current high number of cases, we are currently being imposed again with conditional movement control since November 9th. And for your information, during the initial stage of the movement control order, Malaysians were forced to stay at home and somehow they worked from home. Due to that, most of the community nutrition program came to a stall as we do not receive the physical participation of the community for our activities and programs. Next. Malaysians are already well known to be active users of the internet and social media, whereby the internet use penetrates almost 90% of the population. The nutritionists quickly acknowledged this as an opportunity and strength in ensuring continuous delivery of the services, mainly promotion and prevention, and to an extent in protecting the society from unhealthy eating habits and activities. The Malaysian government as well also addressed the Internet of Things, IoT, in minimizing human interaction and breaking the infection chain. And they came up with a strategy advising telco providers to provide a free 1 GB internet subscription in a daily basis for all data subscribers for free. And next, therefore, we, the community nutritionists, quickly jumped into the bandwagon and to strengthen nutrition education. And yes, with that, nutrition actively goes to media, mainly social media. If SEAMEO RECFON has nutrition goes to school, we have the nutrition goes to media during the pandemic. So we focused on three main areas of public health nutrition, which are the promotion, prevention, and protection. And a lot of issues were raised during the movement control order period, such as frequent eating, snacking, heavy meals intake, trying out unhealthy recipes, and extensive food purchases through deliveries. And as many do not have any other activity, they spent most of their time on gastronomy. Next. Therefore, we came out with many interesting and creative contents relatable to the nutrition concerns due to current pandemic situation, such as to promote vegetables availability at home and vegetables that last longer or less perishable, and high fiber intake to promote satiety and prevent frequent eating at home. And also the nutrient composition of foods were highlighted so as to promote consumption of real foods and protect the community from excessive claims of nutrition supplements at births. Next. We took the responsibility to debunk nutrition myths going on regarding healing COVID-19 or even preventing the infection by promoting the public from false claims. So you can see that we frequently update the information in our infographics to be shared in the Facebook pages and other social medias. Next. We promoted healthy eating through dietary diversity for elite groups to optimize the immunity via healthy eating habits. So you can see all these colorful interactive infographics were actually very knowledgeable for the visitors of the social media pages. Next. And there was a concern in spending for food due to the budget constraints. Many lost their jobs and income during the pandemic, and therefore we came up with ideas on suggesting wise spending to purchase quality food or incorporate healthy shopping ideas to purchase within their limits rather than spending on unhealthy and overpriced items. So you can see that we have different items that can be purchased within the budget range of between Malaysian ringgit of 50 to 100, which translate to between around 20 to 25 US dollars at the maximum. Next. And many voiced their concern of overeating and their choice of food. And therefore, we promoted and advocate nutrition during work from home, such as what they can have for snacks and watching out their meal times and increasing physical activities. Even though at that particular time, we, the nutritionists, ourselves became sedentary due to most of our time being spent in developing all these materials for the betterment of the community. Next. Within days of MCO, many started reporting that they are gaining weight And for that, we created this awareness campaign in a creative way with a sense of humor to visualize and warn what would happen if they do not watch what they eat. So it is sort of a pre and post movement control order, and what would happen eventually if they do not watch what they eat. Next. And these particular infographics gained much popularity among the users, as it does not just provide messages, simple messages without much jargons about healthy eating and active living. And it also contributed as a mean, as a stress reliever for those who had to stay home, and they were quite stressed that they can't meet their family members and relatives. Social media also served as a customer relationship management tool for us, as social media users became more interactive with us. And this is how we actually received more information about their concerns as they open up about the need of nutrition information. So this is how we gain the information and develop the materials according to the needs. And the community actually helped and contributed indirectly for us to provide the information for them. Next. The social media nutrition information served as a resource center for various nutrition information as Malaysia braved through their first festive celebration during the movement control order, which is the Hari Raya Puasa. So we came up with series of healthy eating during the fasting month and Idul Fitri for the Muslims while staying at home. So instead of the traditional method of press release statements and event launching, we went to media to disseminate the information. Next. In order to maintain engagement and create a page loyalist so that these people will eagerly come again for obtaining informations, or we can call it as the marketing tool, the infographics were made to be appealing, especially to the younger crowd, which we know they are the biggest chunk of social media users. And such as the title Singgang Daging Menantu Online, which translates to online son-in-law's beef stew. As I said earlier, many were only connecting with their family members and relatives via online. So this is sort of relatable, and in conjunction with the movement control order that had been imposed. And taking that into considerations, recipes are being shared in order to promote consumption of home-cooked food more frequently during this period. Next. With all these strategies, the Nutrition Division Facebook page, for instance, received 25,000 increase of likes and followers in the period between March and July 2020. And as of now, it has almost reached, I would say, doubled or nearly tripled to a total of 170,000 likes and followers in total. And not just that, the posts and infographics on the Nutrition Division's page were eventually adopted and adapted by other viral platforms such as blogs and other Facebook pages to reach out to all levels of the population. Besides, we also have our nutritionists volunteering as members and admins in other pages to ensure that correct and valid information are being shared without confusing the public and avoiding any bias. Next. Through our engagement via social media, other mass medias also came to realize the importance and needs of providing factual nutrition information. Therefore, our nutritionists are much sought after during the pandemic period, and invited by various local and satellite television channels for nutrition advocacy and promotion. With these, we were able to reach the Malaysian adults, whereby the adult age group ranging from 30 to 40 years old still prefers watching television channels. Next. Nevertheless, overwhelming response were received from the FM radio stations of various languages, namely, I would say in the Malay language, English, Tamil, and even local dialects such as Iban and Bidayu, requesting for radio talks and interviews, especially in the topic of nutrition during the COVID-19 pandemic. And the acceptance was very good as well in terms of segmentation. The senior citizens in Malaysia are still the avid listeners to FM radios. And eventually with this, we managed to reach almost all age groups and segments of the population. This had helped for a better and wider coverage with the collaboration with media. And again, as part of the mission of Nutrition Division of interagency collaboration and active societal participation, therefore the pandemic actually provided a means for the marketing for nutrition programs and activities, and the existence of nutritionists were well acknowledged than before by the community, and eventually this provides a better acceptance for future programs and activities. Next. And as Malaysians entered the recovery movement control order, the government came up with SOP, standard operating procedures, such as the 3 C's and 3 P's and W's, such as the avoidance of crowded places, avoiding confined spaces, avoiding close conversations. And therefore, the traditional method of activities, as we discussed in the practice scope of the nutritionist, can be carried out by strictly complying to the SOPs outlined. And next. Therefore, the nutritionists came out with virtual nutrition services such as video call counseling. As you can see at the first picture over there, one of my colleagues in the state of Johor is actually conducting a WhatsApp call to one of the client and exchanging information regarding portion control and also nutrition information for anemic patient and gestational weight gain. And we can also see that virtual clinic services, for example, are also available, and it is used. The virtual clinic services are called the tele-primary care facility in certain healthcare premises in the government sector. And you can see at the third picture, the facilities being used for nutritional counseling for follow-up sessions. Because the database will be already in the system, and the nutritionist can eventually follow up with the clients or the patients according to the needs and wants. Next. Programs we eventually conducted according to the new norm of 3 C's and 3 W's by having webinars and live events. For instance, the World Breastfeeding Week celebration activities were carried out via Facebook Live in collaboration with private healthcare facilities. And we can see that there is a pediatrician from a private hospital and a private practice lactation expert. And it is moderated by one of our senior nutritionists in Kedah, Puan Faza. And this actually fosters the interagency collaboration, and of all ensures the scope of practice were not neglected by any means. Another example is the nutrition topics webinars were conducted as part of the virtual children's festival in Cebu, Sarawak, as you can see at the picture down there. A few days back, actually it happened just a few days back by our nutritionist Puan Roslinda in Cebu, Sarawak. Next. And group nutrition counselings are also being conducted. You can see the pictures over here. For example, in the state of Malacca, we conduct group nutrition counselings by physical social distancing, and also breastfeeding advocacy were conducted, and according to the new norms. Cooking demonstrations were conducted according to the new norms as well in terms of social distancing to avoid the pandemic infections. Next. Trainings and capacity building as well being conducted as per the SOPs, as Malaysians slowly getting back to their normal lives while adopting to the new norms. So the first picture, the large picture in the slide is actually the healthy catering training module for the food handlers that being conducted. And also we conducted recently, very recently, a few weeks back, the early of November regarding the practice of gestational weight gain according to the Institute of Medicine in the state level in Kedah. And also some of the events being conducted, for example, the Nutrition Month event being conducted at the Federal Territory of Labuan. You can see all these pictures available in the slides. Next. The promotion of e-services such as the My Nutri Diary 2 apps developed by the Nutrition Division actually helped very much and empowered the nutritional counseling clients to monitor their dietary habits and physical activity by themselves rather than to visit the health facilities frequently, and follow-ups can be made virtually. These apps actually can be downloaded by anyone, and it's very accessible through smartphones, and therefore the follow-ups being conducted by the nutritionist according to the data being keyed in by the client themselves, and the data can be shared with the nutritionist during their next counseling session and even virtual counseling sessions. Next. Above all, the community empowerment through the Community Sehat Pembina Negara COSPEN program that had been going on for the past few years actually helped in materializing the division's objective, because the trained member of the community themselves become the agent of change and nutrition icons. They become the nutrition icons to ensure good nutrition are being part of the community lifestyle in their villages or neighborhoods during this challenging time. So the activities are conducted, and these were actually the activities being conducted before the pandemic itself. So I just share it, and eventually during the pandemic, it's more to even regulating the activities through WhatsApp groups and telegrams and etc. And with regards to above mentioned, next slide. So with regards to the above mentioned practices during pandemic, fundamentally the scope of nutritionists remains the same, even though there are changes in the method of delivery. So we still advocate and promote nutritional well-being. We prevent and control nutrition-related diseases of various groups, assess, monitor, and evaluate nutritional status via interactive sessions, and develop and implement nutrition interventions, provide nutrition communication materials, coordinate and carry out multi-sectoral nutrition activities, and undertake capacity building through education and training. So it is not definitely the scope of nutritionists remains the same. It's just that there are changes in the method of delivery. Next slide. Being community health professionals, let me just share before I end my discussion today. A number of our nutritionists also offered themselves to become a part of the manpower during the pandemic management, such as the gatekeeping and screening prior to entry into our health facilities premises, data entry of COVID-19 screening, and mobile health information dissemination, traveling to localities, and home visits being conducted, for example, for the food baskets programs. So all this actually being done with fully complying to the SOPs as per outlined by the Health Ministry of Malaysia. And next slide. To conclude, the fine-tuning and adopting new delivery methods, the community nutritionists in Malaysia remained relevant as the key driver of national nutrition towards developing a healthy generation as per the organization's vision and mission. And therefore, thank you for giving me the opportunity to be part of the webinar and share the community nutritionist role in the public health community. Thank you for listening, and handing over to you again, Dr. Grace Swange.
Yeah, thank you, Thirus. Thank you so much for your valuable sharing. I think it's really one thing that amazed me is that the that you get a facility of 1 gigabyte for internet. So, I mean, like in Indonesia, I think only students and lecturers or teacher get that facility. But I think it's also important for community nutritionists, especially, to get also that that kind of facility, so they can do more of nutrition educations. Yeah. And
Actually, it is also for the public, so that they can access the internet services.
Yeah, it should go both, yeah, because if it is only the educators, but then the consumer doesn't really have the data, maybe it's a bit useless. Yeah. Okay, so we already have a lot of questions coming from the audience for all the 3 speakers. So I will limit probably to 3 questions first to all the speakers. Can we have the question showing up? Okay. Yeah, thank you so much for your active participation. So this is the first question for Ibu Lina. It comes from Angelina Kelly Dartanto from Indonesia. She wants to know, because she's graduated outside Indonesia from UK. She wants to know whether there's any program so she can transfer or basically practice as a certified nutritionist in Indonesia. And I think the second question is actually for Pak Sugeng, yeah, how she can join the associations. Thank you. Maybe you have any comment, answer first, Ibu Lina, about how is it necessary to have a program, integration program?
I think for the nutritionist, you can first maybe Pak Sugeng have many answer for this ya Pak ya, because I only know from program things, but for the how we can build the career and how we can be a nutritionist, a registered nutritionist. Maybe Pak Sugeng know more ya Mbak Grace.
Yeah, Pak Sugeng is still here. Maybe Pak Sugeng, you want to answer this? So how? Yeah.
Thank you. This is very good question. Yeah, I think right now in Indonesia, many nutritionists graduated from other country, both Indonesian citizenship or from other country also. Actually, if you want to be the member of PERSAGI, please send a letter to PERSAGI. I will give you the address, yeah. Then attach all the document or certificate, for example, diploma or ijazah, with maybe if you already joined the organization in your other country, please also attach in this letter. And also, I think that's all. Then we will evaluate, then give you information what is the step will be do by you, including for the like penyetaraan ya, or what I think that we still develop the document for the nutrition from other country. That's why please, if you want to join, please send a letter attached with all the related document to us. Thank you.
Yeah, so I think we can provide your the email address of PERSAGI. So so there won't be any test or obligation. I know, because as a medical doctor, if you graduated from outside Indonesia, you have to join like a special program. So you have to sit in the Faculty of Medicine for several years. Depends on your where do you come from. So that's not applicable for nutritionists, ya Pak Agus ya. Pak Sugeng.
Almost the same. Almost the same.
Almost the same.
We will compare the curriculum. There will be like a training or job training at the hospital, something like that. Almost the same.
Yeah. Okay. Yeah, but then it will be decided by the PERSAGI. Yeah, on how many years you should sit in the hospital or in the community. Yeah. Okay. Interesting. Yeah. So the first thing first is for Angelina is to write and contact PERSAGI, yeah, So it is possible because we have such a lack of nutritionists working in Indonesia. So I think it's a good idea if someone who graduated outside can also work here. And yeah, so I will go to the next question, I think. This question comes also from Indonesia, from Sari to Pak Sugeng. She's asking whether is there any action plan to improve the distribution for nutritionists in public health center, especially in puskesmas in Indonesia. I think I also saw some other question asking a similar question, was asking, is there any actions or collaboration between Ministry of Health and also PERSAGI in terms of trying to make the distribution of nutritionists is more more balanced in Indonesia. Maybe both Pak Sugeng and Mbak Lina can actually address this question.
Maybe Mbak Lina first as the government.
Yeah, actually for now, we are still, like Pak Sugeng mentioned, we are still discuss or for the regulation, but and how, firstly, maybe we are trying to collect the data, or how many nutritionists need in each area, and then we are collaborate to the PERSAGI to in terms of uji kompetensi, and then how we can distribute or send the nutritionist. It is also according to join with PERSAGI in local area. So for the Ministry of Health, I think our rule until how the regulation is developed, and then how many the resources needed for each area, and how many we have from university, from polytechnic, and beside that, maybe we have another program like Nusantara Sehat, so we can before we can distribute the resources, because of still wait for the regulation, we are also still can put the nutritionists in also, especially in remote and border area, like this, like that, Mbak Grace.
Okay, Pak Sugeng, do you want?
Yes.
Yeah, you want to add something?
Lina already mentioned about the Nusantara Sehat program. This is also for remote and border area, but also since now the government prioritize in stunting reduction, and also the government can use local government, even both national and subnational government budget, they can use for the contract for the nutritionist. That's why at the puskesmas as in a locus area for stunting, they can use stunting budget for the contract for the nutritionist. This is also the opportunity for us to deploy nutritionists at the locus area of stunting. Thank you.
Okay. Yeah, I think I hope that's clear for Sari. Yeah, so there's already an action plan. One of them is actually Nusantara Sehat, and those nutritionists were deployed or given was hired in a contract with using contractual basis. Yeah, that's one of the effort that between the professional organization and the MOH of increasing the distribution of nutritionists in Indonesia. Can I go to the next question? I think the next question is for Thiru, is from Bintang in Indonesia. So the question is actually related to the previous question. How about in Malaysia? Yeah, how about the primary healthcare distribution of nutritionists in the primary healthcare in Malaysia? And is there any specific regulation to make it more distribute equally or something like that?
So is it a minimal number of public health community nutritionists?
Yeah, so one of the questions is there any minimal number? So if you have a primary healthcare centers in Malaysia, it should have like 1 or 2 nutritionists probably,
Okay.
I think. Yeah.
All right. As discussed earlier, the number of health clinics in each state and district levels, for example, will be more than one, definitely. But due to the constraints and from the public service department, for example, because they are involved mainly in the recruitment of these, getting nutritionists to fill the posts, and therefore there's no minimum numbers for every state or district in Malaysia. However, there are no maximum numbers, I would say, but as a minimal number, we have every district with one nutritionist post. So therefore, they can actually the programs and activities can very much regulated with a minimum number of one nutritionist at every district level. So therefore, in some states, for example, Sabah and Sarawak, it is not called districts, but it's called as bahagian or kawasan, division or the area. And few districts come into one division or kawasan. So in that areas, in that states, they have at a minimum of one nutritionist. And for example, in my district where I'm working currently, in the Kulim district, we have 2, and some districts in Kedah, we have around 5 nutritionists, and therefore the number varies. And for the information, the minimum number is actually 1 for every district.
Yeah, I think we have similar number according to the new regulation for primary healthcare in Indonesia. Is every primary healthcare center should have at least 1. But if you have like the one who can treat patients for inpatients, they can have 2. I think that's the new regulation, the PMK 43. Yeah.
All right.
Yeah, so it's a similar situation.
So we hope that in Malaysia we can have nutritionists in every single primary healthcare facilities too.
Yeah, that will be our dream.
Yes.
Okay, next question. This is the question come from Pak Agus from Indonesia for Ibu Lina. So the question is because every education institution will also need a nutritionist. Is there already any steps that or any action plan that how we can also fill in the nutritionist requirement or at school or universities? Is there already a plan for that? Maybe from the Ministry of Health?
Actually, for a plan, there is, yeah, Mbak Grace, but like previous I mentioned, we are firstly we are trying to trying to develop the regulation first, because after the regulation there, maybe we will use or will collaborate with the university or educational institution, the other educational institution like Polytechnic, to maybe like let the graduated to like penempatan di desa gitu. There is wacana to put the graduate student to in desa. There is wacana.
So, for the graduate student of nutrition to have a practice like the medical doctors, they have to do some practice first. Yes. Okay, so there's a chance, there's a plan for that in the future.
Yes.
Okay.
But first we conduct the regulation first, but that's
the steps. Is there any clue on when this regulation will be available?
The target the end of this year's, but maybe if I think in the mid of next year.
Mid next year, okay. Yes. So hopefully next year we will see some nutritionists actually working at school. Yeah. Also, how about what do you think, Pak Sugeng? So as a professional organization, you already strive to have more nutritionists work in the primary healthcare centers, and now there's a new opportunity to work also at school as a school. Yeah.
Good news also for us. We can deploy and support the school institution or both starting from the lowest elementary, primary, tertiary, and also university. But I think now, while waiting for the regulation, we can support and the school can collaborate with Puskesmas and also with PERSAGI. PERSAGI will support the school to deploy or a temporary contract or something like coordination for support the program, because we have at PERSAGI we have office national, province, and also in the district or city. Because in national we have DPP, in province we have DPD, and in district we have DPC. That's why if the school or university need nutrition, you can contact us, then we can support you with nutrition. Thank you.
Okay, that's interesting fact that actually schools can request to PERSAGI to if they need assistance in a school nutritionist. Okay.
Yeah.
Okay. I think we really need to put your contact email later, yeah, in the YouTube channel so people can contact you. Yeah. How about in Malaysia, Thiru? Is it the same situation for school? Is there any already nutritionist deployed at school?
We had a pilot program by deploying nutritionists in the education sector at one of the states for like around 1 to 2 years. But eventually the post was returned back to the Ministry of Health. And however, the nutrition division is currently preparing so that in terms of the long-term mission or objective, to ensure that at least we have one nutritionist at the we call it at the district education office, so that these nutritionists can contribute for the nutrition activities and programs in schools at the district and even state levels. So we hope to materialize very soon, hopefully.
Yeah, that's also a good idea. Yeah, just put one first in the district office, yeah, so they can make a better program. Okay, interesting. Next question, probably. Okay. Next question comes from Dewi Sofia for Pak Sugeng. As you mentioned in current development of non-government HRH, private sector is more competitive. Is it that mean that private sector already included NGO or UN agency, and therefore as a nutritionist you should have a certificate, etc., etc., if you're working in an NGO? I think that's the questions. And then can you briefly explain about the level 1 to 4 of career of health workers, probably Pak Sugeng?
Yes, thank you. I think now in the private sector, this is also competitive to get the position, because actually in the private sector they have they already setting the post description every job, including for nutritionists. That's why in the private sector they already make a requirement, including the basic education and also training. This, in my experience, because actually my personal experience, I am previously as the government official almost for 25 years. Then also I have experience in NGO, both national and international. Right now also in UN agency. That's why mostly UN agency, NGO, and private sector, they already make a requirement for the nutritionist. That's why this is quite difficult, including, of course, with English language. Yeah. That's why if the nutritionist for the level 5 mean academic gizi or diploma 3, particularly for the lowest level, if diploma 3 is okay, some of the NGO can by School of Nutrition at the level 5 or diploma 3, but some of them need requirement as a nutrition level 6 or level 7. but some of them also nutrition level 7 with certain certificate like dietitian or like management of nutrition program, something like that. That's why at the private sector also like that. But in the government also, now some of them still the requirement is still a diploma 3, but mostly now already diploma 4 or full degree or sarjana. That's why now my organization as a PERSAGI, this is our challenge, how to improve the degree of the education for our member, because our members still have many in diploma 3. That's why we encourage the government to improve the degree of education. But I think since three years ago, the government through PPSDM, Human Resources Board and Development for Health Resources, already implemented RPL. RPL means to improve the degree of nutritionist from diploma 3 become from diploma 1 become diploma 3, but from diploma 3 to be a diploma 4 or S1. This is by some of them supported by government or with fellowship, but some of them they have to pay by themselves. Thank you.
Okay, so hopefully it's clear, and if it's not, I think you can always contact Pak Sugeng for this level. But it is really, I think the point is it is really important to be competitive. You have to increase your capabilities, and I think it's not just related to nutrition, but also other capabilities if you're going to get to the higher level. Yeah, I think I just go to the next question. Can I see the next question? I think, this is a question from our Bu Judiastuti Febru Hartanti, Ibu Judith, for Thiru. She found it interesting that you mentioned about the recipe modifications to promote healthy eating. What kind of venues that you use to communicate about this topic in the community?
Okay. Hi, Buju. For the venues, if it was before the pandemic and even after the pandemic, the recipe modification were actually conducted at the community healthy kitchen, or we call it as Dapur Sehat Masyarakat. It is actually located at various locations or scattered around the states of in Malaysia. And this Dapur Sehat actually being a center or the venue for the locals together with the nutritionists to come up with developing and testing new recipes so that they can develop these healthy versions of the recipes. And during the pandemic period of time, the nutritionists went an extra mile by developing, recipe modification at their own sweet home to ensure that they can share the recipes via Facebook Live and even Facebook infographics. And for example, during the initial stage of the movement control order, the Dalgona coffee were very much famous in Malaysia, and therefore it was very simple modification, I would say, to reduce the sugar and to replace from using creamers, non-dairy creamers with full cream milk, and these are being shared with them through infographics and Facebook Lives to the community. And if it's not during the pandemic, definitely these recipes and the cooking demonstrations are being carried out at the Dapur Sehat Masyarakat, the community healthy kitchen. And actually one of the pictures that I have shared earlier, it shows the healthier modification of the bubur ashura that Muslims usually consumes during the Hari Raya Haji. So we conducted in a sort of competition among the locals, and therefore the nutritionists become the technical experts for the recipe modifications. And yeah, those are the venues that we use in communicating this topic to the community.
Okay, thank you. That's interesting. Yeah. So as a nutritionist, you also have to be aware of what is still a trend in the community.
Exactly.
And then just kind of answer. It's not like I like that about dalgona coffee. You're not really against it directly, but it's like okay, okay, it's okay to have it, but then let's modify it a bit. Yeah,
Yep, it's true.
yeah, yeah. That's a kind of a positive reinforcement that I think is a good communication way, a good way of communicating a healthy message. Yeah. So I think that's answering Bu Judy's question. So we go to the next question. I believe this is for Bu Lina. Can we go to the next question, please? Okay, let me see what are the next question. Yeah. Oh, I think the next question is for Pak Sugeng directly. Okay, so Pak Sugeng, there's a question from Fauzia. She's asking about the workload of nutritionists in the health center of some areas in Indonesia is high. I think this is already answered actually in the first question, yeah, about how PERSAGI work with. Oh, but the question specifically looking at whether PERSAGI work with the local government. I think in the first question you already kind of mentioned how PERSAGI work with the central government, but is there any specific innovation that was conducted by PERSAGI with the local government?
Yes, same. We work with both central and local government because actually we every 2 months, yeah, we meet with the chairman of PERSAGI at the province level. They discuss if there is any difficulties how to deploy the nutritionist. That's why we also encourage or to do advocacy to the local government to use our capacity, even technical advice, or sometimes they can deploy our nutritionists. That's why this is our mechanism to build the networking both with national and sub-national level. That's why we encourage to the chairman of the PERSAGI at the province to close collaboration with local government. This is also our strategy how to manage our capacity and also to availability of the nutritionist. Because actually I don't have nutrition at the national level. All my member at the province and district. That's why we do the advocacy to the chairman of the PERSAGI at the province how to work with local government. For the central government, we support the regulation both to the Ministry of Health, even in the Ministry Directorate of Community Nutrition, and also in the Badan BPSDM. Thank you.
Okay, so it's a similar efforts, but then majorly work at in the local level, I think, yeah. With the provincial PERSAGI ya Pak, berarti ya.
DPD PERSAGI.
Okay, okay. So that's also a thing that you have to probably people in Indonesia can also explore, yeah, looking at their own regional associations, nutritional association, regional PERSAGI, yeah. So they can what can they help more for the nutrition issues in the local area. Okay, next questions. I think come from Malaysia, from Atika for Thiru. She would like to know whether there is any chance for private sector to collaborate in any community nutrition event with nutritionists in Malaysia.
Okay, definitely. There are many programs that we can incorporate. Collaborate with the private sectors. For example, I've highlighted a few of the programs earlier, so they can join with us in the programs. But there is some limitations that I would say in terms of the collaboration. So as long as we do not, as long as we abide with the ethical codes and also by the regulations by the nutrition divisions has been set up. For example, I would say the code of ethics of marketing of infant products and related products, for example. So we ensure that there's no bias towards any particular brands or companies. So if there's no issues regarding that, definitely we can collaborate with them, especially food industries. So we realize the importance of the food industries in the community. So even though we don't give any importance to any particular brands or companies, but if they come in a group, a different number of companies and industries or even sectors, we can definitely collaborate for the community nutrition events. So we have a number of events, for example, Nutrition Month celebration. So we have these private sectors coming in to join with us in terms of promoting their services and products for a better community development in food products or even healthcare, physical equipments, for instance, and even their services. So as long as it does not goes against our rules and the code of ethics, definitely we can collaborate with them. And Ms. Atika, no matter wherever you are, you can contact with the nutrition division at the Health Ministry at Putrajaya or the relevant state health departments if you have any ideas or suggestions in terms of the collaboration. So definitely you can contact them.
Yeah, thank you. Thank you for the explanation. I hope it's clear for Atika. Okay, next question. I think this is supposed to be the last question for Ibu Lina. It's come from Oki Lupita. Theo's asking about, there's a data in your slide about the distribution of nutritionists until August 2020. And there is a number, there's a data showing that in DKI Jakarta, the number is only 6. Is it true that the distribution of nutritionists in Jakarta is actually low? Because I think I also saw the same thing in Pak Sugeng's slide, yeah, that the second province that have a lack of nutritionists is actually Jakarta, and the first one is in Papua. So is it a true case? Because we think that, of course, in Jakarta, in the capital, will have enough nutritionists working here.
Yeah, thank you for the question. Actually, this is the data until August on 2020, but it is only in locus area, in area focus, yeah, in area focus. Then I think not all of the area in Jakarta is focus area. So that I think more than this, yeah, because it is only focus, and then I think until now it will any updated data again. And I think it is more than 6, yeah, for now.
Okay, like, so, but is it true that in DKI Jakarta, there is also a high need of community nutritionists?
Actually, because yeah, not really high need, but I think there's still need because why? Because the population in Jakarta is different with the other area. So the need for the nutritionist is different with the other area. Maybe if the other area need only one nutritionist, but in DKI maybe we'll need more. So for this, for the need of the nutritionist, we also coordinating with the local government, and also for the until Puskesmas, how many resources that they need. So I think for the DKI is like that because of many of the population, so that the need of the nutrition is also different with the other. Like that.
Okay. Yeah. Okay. So of course there's still need, but maybe yeah, different area will have a different need and different. So they need different numbers of nutritionists. I think that will be your answer, Lina. Thank you so much.
I will add some
yes,
additional.
Pak Sugeng. Yes, please.
Yes. I think in Jakarta is quite different with other province, yeah, because in other province mostly puskesmas at the sub-district level, but in Jakarta it is in kelurahan. That's why in my observation, not mostly puskesmas at the village level do not have nutritionists. That's why the number of nutritionists at the puskesmas may be very few more, or the survey maybe they will conduct it at the puskesmas kelurahan. That's why not all puskesmas in kelurahan do not have nutritionists. But I think Jakarta also need nutritionists. Even at the, maybe if possible, they can deploy with the local government budget at the until puskesmas at the village level or kelurahan. Thank you.
Okay, thank you, Pak Sugeng, for the additional information. So I think with that, I will conclude this question and answer session. But before we ended this session, I would like to ask maybe a last statement from each of the resource person, from the speaker. So Thiru also mentioned about, I think all of three speakers mentioning about the influence of the pandemic COVID-19 to the work situation of a community nutritionist. But instead of the challenge, I see that this COVID-19 that just celebrate his birthday 2 days ago is kind of a momentum part for us as community nutritionists to actually become a better, I don't know, an advanced community nutritionist, right? Because then we already apply a lot of channels that previously we don't really think about these channels as a part of our work, how we can deliver more nutrition education through social media or other channels, for example. So I would say that this is a momentum and it's not really a challenge. And also this week, actually, we celebrate the primary healthcare research week for the whole week. So not just COVID-19, but also this is quite a good momentum for us this week to look at the role of the nutritionists in the community in primary healthcare. So I would really like to see in the future maybe the evaluation of the things that the innovation that we already did during the pandemic, and whether this is actually more effective than the things that we did before we have this pandemic. So maybe from Pak Sugeng, Mbak Lina, and maybe also from Thiru, is there any statement, last closing remarks from the three of you about the role of nutritionists in the future?
Maybe from me, but try
yes.
to support the student here. Yeah, just keep spirit, because the nutrition problem in our country is still abundant, and I think it is the role of the nutritionist very important, and can reach any kind of field, yeah, to support us, the government, in reducing the nutrition problem, especially for stunting and also for the non-communicable disease that going to rise until now. That's all, Mbak Grace.
Okay, thank you, Bu Lina. And next, maybe Pak Sugeng or Thiru?
Yes, thank you for the last statement. I think in the process of, during the education process, we have to improve the quality of education through interprofessional education, collaborate with other department, midwife, nurse, sanitaria, and others. But if already graduated, we have to collaborate also with the other professional association through interprofessional collaboration, because this is a good opportunity for us to improve our knowledge and skill with partnership and building networking with others. Thank you.
Yeah, networking is important, Pak Sugeng, agree. And Thiru, lastly?
So I loved Dr. Sugeng's speech earlier. And for information, as said by Ibu Lina, even in Malaysia, we have similar situations that in terms of employment of the nutritionists. So I think that with the current pandemic and even before that, the situation has much changed, especially in the field of public health nutrition. So we hope that in Malaysia itself and in the region, the role of nutrition is being acknowledged, and sufficient numbers of the nutritionists are being recruited and deployed for the betterment of the community. And for everyone who's present today in the webinar, I would encourage that all of you can actually visit our Facebook or even Instagram page called Bahagian Pemakanan Kementerian Kesehatan Malaysia, as you can follow our page and read up all these materials provided there. And of course, it's in Bahasa, but definitely it wouldn't be a problem for our neighboring country, Indonesia, to understand the basic words, right? So I'm sure all of you can gain more knowledge and information regarding nutrition over there. And besides that, if you need more information, you can definitely visit the Nutrition Division website at www.nutrition.moh.gov.my. So do visit us and do contact us for more information, and we hope to see you soon and more collaboration being done in the future.
Thank you so much, Sheru. Yeah, so yeah, that's very interesting. I see some of your infographics actually kind of fun infographics. I think we need to learn, because I think in SEAMEO RECFON we usually make a very informative infographics without putting some humor in it. I think we need to sometimes.
If you allow me to take this opportunity to actually congratulate the social media team of nutritionists in the nutrition division. So actually there's a dedicated team to come up with all these materials. So I think they've done a very good job in terms of providing these materials, and that actually what created the engagement with the public. So I take this platform to congratulate them, and hope they can do even better in the near future and the future as well. Thank you.
Okay, thank you. Thank you so much. Really appreciate your efforts there. Okay, thank you so much for all the three speakers for very valuable sharing. I think we learned a lot of the role of nutritionists in the community. I will give the podium now to our Master of Ceremony, Ibu Effie.
Thank you, Mbak Grace.
Thank you, Pak Sugeng.
Thank you, Grace.
Yes.
Thank you, Bu Grace.
Okay, so me too. Thank you, Dr. Grace. Yeah, it's a very interesting presentation and discussion actually. But since we have a limited time, so this is not this marks the end of this webinar session, of course. And allow me to thank to the SEAMEO RECFON and the Nutrition Study Program, Faculty of Medicine, Universitas Indonesia, for conducting this webinar, and also to the honorable resource persons. Thank you very much. And also to the participants. It was my pleasure to be the Master of Ceremony. I'm sorry for this domestic things. It was my pleasure, to be MC, the Master of Ceremony today from this webinar, the role of nutritionists in public health community. So I apologize if any words was pleasing to you all during this this event, and let us all be guided by the things that we have already learned and heard, from all the honorable speakers just now, and we hope to see you again in different sessions. Thank you very much for your attention. I'm Evi Armayani. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you.
Thank you.
Thank you.